Welcome back to another episode here on the Hart and Hustle podcast. Our next guest, he calls it going to the dark side. But Doctor didn't just leave the front lines, he found a bigger way to actually serve them. Doctor, how are you, man?
Very good. Thanks for
How
having me.
often does everyone call you Doctor? Can I just call you Doctor to this whole thing? Is that okay?
Yeah, with how long my last name is, I go by Hey You, Doctor, Doc, Dr. D. It goes on and on.
How do you pronounce the last name?
It's Gopalakrishnan.
Yeah, I would have butchered that
Yeah.
for sure. I would. No, man. So you went from round table to actually running a hospital. Like,
Yeah.
what made you take that big leap?
It's not something I had planned at all. I think I mentioned to you in the past when we met. My parents were immigrants, really focused us on like making an impact. That was kind of what they'd always talk to us about, not making money, but really how do you change the world? And that was always our focus. And that's actually what drove me to becoming a physician, really the passion of making impact and caring for patients. And then I started practicing, and I became a hospitalist, and very early in the hospitalist movement in this country. And what happened was, within a few short years of starting to practice, we became a really big practice, and we had a lot of growing pains, and so there was a lot of problems operationally, nothing to do with medicine. On how do that made me get involved. And what I realized at that time was when I take care of patients in a single day, I took care of 15 patients, and I made a great impact. I felt great about it. But when I started getting involved in this leadership and doing different things, I recognized I was making an impact on all my partners, how they practice. And that gave me a sense of fulfillment. And I realized, wow, I can actually impact more patients. And that's how my kind of leadership journey started. And then it just kind of has taken off from there.
You pretty much realize you can multiply by just leading, right?
Yeah.
Like, that's all you got to do, just lead, and people will follow, man.
Yeah.
So that's good. I love that. And you talked about your having immigrant parents.
Yeah.
I'm pretty sure that instilled a lot in you. Like, what still guides you today from having these immigrant parents?
Yeah, they were very focused on making sure, like I told you, the impact was important to them, but hard work. So they when I was younger, I wasn't the hardest working person, and that would just infuriate my parents because they're like, you have all this potential and you're not doing the best you can, and so that I didn't hear it growing up, but it clearly sunk in.
That is too funny.
And so
That's
it's all
usually
about,
how we live.
To me, like I don't mind failing. I don't mind, not accomplishing something. I care that I put everything I can into it.
So good. No, that's so funny. I mean, I think we all that person when we're young, right? We're
Yeah.
not really listening, but we are. I always say this, as even being a father. Your father, you said, right? I
Yeah,
think
yeah.
we
My
spoke
kids.
about that. So your kids may not be listening to you now, but they're watching everything Dad does.
Yeah.
So they'll really imitate all of that as they go out. Right now, you're like, why are you not listening to me? But no, believe me, they're soaking it all in.
Yeah.
You joke about going to the dark side.
Yeah.
What surprised you most about the shift of going to the dark side?
What surprised me the most is I didn't realize when I was a clinical physician all the things that the leaders are balancing. I had this mindset of, they're sitting in the office, drinking coffee, making decisions, coming at 8, leaving, 4:30, and it looked easy. And then I got in and I realized, oh my God. As I was going through these different roles, it's all competing priorities, and there's only so many resources, and now you're making judgments, and that was the thing that I think I realized that the clinical team didn't understand all the pressures and the decisions that the leaders were trying to make, and vice versa. I don't think on the leadership side everybody understood the day-to-day challenges that our frontline doctors and nurses and staff have when we make decisions on something that's going to impact a frontline provider's workflow. We're like, oh, it's just one little thing. And then it's like, but for them, it's like 1,000 little things, really, and so it made me realize, like, wow, neither side understand each other very well.
Correct. And I think that's where you come in, where you want to create this space where your staff can actually challenge you,
Yeah.
right, without fear.
Yeah.
How does that happen? Is it in place? Do you see it already different than what you had it back when you were just on the front lines?
I mean, it's 20 years ago to now, it's light and day difference in just medicine in general, right? Medicine evolves, the EMR, electronic health record evolves, the community evolves, everybody's changing. And so it's hard to say, like how we did it 20 years ago is how we're doing it now. There's challenges. And I think that's the thing about what I really appreciate about leadership is no one year is the same. No one, and things are changing. And if you don't have your antennas out there to understand what's happening in your community, in your patients, in your doctors, your nurses, your frontline, your leaders, if you don't understand those changes, you're never going to be able to pivot the way you need to. And you can't ever, there's I'm sure you've read like Simon Sinek's stuff around infinite mindset, and that really resonates a lot with me, because there's not a start and a finish, and we always think there's winners and losers, and there's not. It's about surviving and sustaining and improving, and so you're always having to kind of do that. And so that's kind of how I would kind of answer that.
Yeah, no, I appreciate that. And mindset is everything. When you mentioned mindset, like I love the mindset, right? Literally created a journal called Mindset Reset.
Yeah.
Because as leaders, man, in this space, we kind of need that at times, man. We show up, we put on these different hats at times, like, maybe CEO one day, but then maybe you're also helping out at the front line, where you don't need to be. So I love that you just talk about also evolving. What does it actually look like today?
Yeah.
And what it looks like today is that 95% of scribes is doing documentation, right? What does that unlock for doctors, that scribes is now a thing where we could have more actual face-to-face conversation versus them never even really know what we look like. They can see us in the streets and never even know that they just served us, right?
Yeah.
I think that's kind of what it was, the reality of it.
Absolutely. I think this is the most exciting time in medicine for that reason. We have taken our frontline clinician away from what they went into medicine to do, to take care of their patients and have a connection, right? We've given them so much administrative burden that it makes it harder for them to do their jobs. I also think the other thing is, if you talk to people in my role across the country, they're going to tell you their biggest challenge is workforce. We don't have enough frontline staff, doctors, nurses in this country now, and it's only going to get worse in 10 years as the population continues to age. So we're going to have to work smarter, not harder. We're going to have to make it more fulfilling for our providers and our physicians and our nurses to be able to work with their patients and not feel, oh, now I have to go do another hour of something else that has nothing to do with patient care, but more to do with documentation or X, Y, and Z. You know what I mean? Like my wife, I think I shared this with you. She's a nurse practitioner, and every day she works clinically seeing patients. Starting about 6:30 to 7, she's at our dining room table till about 10 or 11, and she's miserable doing that. And that's not what she enjoys. She enjoys the patient care aspect, and I think this is where we talk about the AI scribe, but to be honest with you, I think there's a lot more of. I think we're just scratching the surface. Of how technology and AI can support, not replace, but support our physicians and nurses and clinicians to do their jobs better.
Doctor, you had to emphasize on support, not replace.
Yeah.
Why? Are you hearing the fear that people are having of replacement? Is that why you had to emphasize on that?
Yeah, I did, because I mean I've heard from not actually from nurses or doctors, but I've heard I'll be listening to the radio or TV or read something about this is going to replace this field. I'm like, there's no chance that's going to happen. Like you need, but we need augmentation. So you know what I mean? Like we need to be able to make our clinicians, frontline staff feel like they're providing the best care they can, and not overwhelm them and not cause burnout. And how are you going to do that when the need for them is going up, and the supply of them are not to the same degree?
That's correct. Now, I was wondering how AI plays a role in the healthcare space,
Yeah.
right? And when I hear some of the things that are being implemented,
Yeah.
especially AI scribes, I always share this story, man, because this lady, I went into the doctor to get my yearly checkup, and this is where my wife usually goes. However, it was not the same doctor, but I didn't know that because I don't even know what her doctor looks like.
Yeah.
So I'm talking to this doctor, and I was like, "Oh, I think you met my wife," and she's like, "Oh yeah," and she's like acting like she knew what I'm talking about.
Yeah.
So I go back to the car and I tell my wife, like, "Hey, the doctor XYZ." She's like, "That wasn't my doctor." I'm like, "Well, she definitely sold me like she knew exactly who you were, but that was just her trying to,
Yeah.
make small talk. All right, we gotta keep it going.
Yeah.
I got. So I'm like, man, this is the experience that so many people have,
Yeah.
and reason why many people don't show back up,
Yeah.
to appointments because they just didn't like the experience of what it actually felt like, and then it makes every other doctor look bad too, when in reality it just could have been that one, in the way that they kind of managed it. So now I love it, man. You think there's anything else when you think about how AI could be a part in healthcare that could really change the game?
I mean, think about this. Just time. I'm just going to give you a pretty concrete example. In our EMR, with one of the EMRs, AI can look back in the record, right, and assess. So let's say you're coming to see me for the first time, but you have a record in our system, and you've seen a lot of people, and it's a 10-year record. For me to really do you justice, I need to understand your history if I'm a specialist of all the things you had. And that means that takes me time to go through and process and put together, right? In the sense where we're able to take that 10 years, digest it, and at least put a blueprint in front, a first draft in front of the doctor that's about to see you, that knows, here's your high-level summaries. Boy, does that save a lot of time, and the doctor can still go in and investigate. So you know what I mean? You're doing a better job of caring for the new patient, because you as a physician don't have 2 hours time to read through the chart, to see to see you for your 30-minute visit. So I think those kind of things are going to really make meaningful impacts.
If the Hard and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. I like that. No, I can't wait to see how this really changes the healthcare world. But yeah, that makes so much sense. And people don't realize, as you mentioned, the tool and the resource it could be saving you time to do the things that you love more and the things that you hate less. Right? The admin task, all of these repetitive things that is like, oh my God. As you mentioned, I just want to help people. And a lot of people that became nurses and doctors, you always hear it's because I wanted to help. But it's how you really helping when you don't even have the time to help, So I love what you're saying, but I want to know from a leader perspective, right? This is somebody that's sitting in the what do they call it? You're a suit. Is that what they call you guys? Right?
That's what my friends call me, actually. they all my physician friends, that's the running joke that I'm joining the dark side. I'm a suit.
I heard that, and I went to my mother-in-law, said, because I didn't realize it was a thing, and I was talking to someone else, and now I'll never forget that anytime I see you, it's like, yo, you a suit, huh? No, but COVID broke a lot of systems. But I also feel that it changed a lot. Like, what did it help rebuild in your eyes as a leader in this space?
For me, the thing that it helped me with is healthcare was always, I would call it a big ship. Anytime we wanted to make a change, we would sit and talk about it. We'd have another meeting about it. We'd then say, well, let's pick this date.
Oh, man.
Let's pilot this for a little while. And so something simple that we could have actually just done in a week and get going, we might have taken a year to decide to do. I'm exaggerating, but you get my point. But COVID, like, we were every day we're trying to see what the inputs were, what was happening, strategizing, changing, and then reassessing, and then doing it again. And things like at our hospital, when we had COVID patients, you had to put them in something called negative pressure rooms, a certain pressurized type of room. Well, the hospital, usually most hospitals don't have the entire hospital like that. They have maybe 20 beds, because that's not something you needed. So we had to quickly figure out, how do you do that for a hospital if you needed 100 beds? And so, our facilities guys, our biomedical engineers, that, across the country, they've quickly figured out ways to make temporary negative pressure rooms so that we could be able to, and it's very quick. And I think that's what it showed all of us, that like our old style of really thinking through everything to the nth degree isn't always great. And so
We're too comfortable.
yeah, way too comfortable. So you gotta be able to like make some assessments quickly and move. And that doesn't work in every area, but there's a lot of areas that we just are way too comfortable and pontificate way too long.
I love this. See, I had to ask this question, man, because there obviously when you're in it, the pandemic, when we were all in it,
Yeah.
it seemed like never ending.
Yeah.
But as we come out of it, like, yeah, there was so much negative in that moment, but I felt like we also just evolved as a world,
Yeah.
right? In the way that we see things and the way that we actually communicate. Mental health became a conversation that we
Absolutely.
weren't having, right? Like, how crazy is it now that mental health is probably one of the most used words right now,
Absolutely.
in high school.
Yeah.
In high school, you're not talking about mental health. So the times has changed. So I think
Yeah.
there was just a lot, definitely. And I love the way that you kind of you said it. We're so comfortable. It
Yeah.
allows us to just become innovators, think creatively,
Yeah.
use those skills that we haven't probably used in so long because it was just the same, day after day after day, man.
Yeah, absolutely. Absolutely.
You mentioned trust and healing, right? What have you learned about trust and healing? And not just for patients, but even for staff themselves?
Yeah, I mean, I think the trust and healing for staff is probably the biggest challenge that I think all of us have faced in healthcare post-pandemic. I mean, as the first wave of the pandemic was happening, healthcare heroes, there were parades, they were all, and then it changed, and I saw a survey kind of in the last 2 years, like after the pandemic, and they were looking at it was a survey around with healthcare workers, other essential workers like police and fire departments, and what they saw was like the healthcare worker post-pandemic, their kind of thought on mental health has gotten worse. Their thought of burnout had dramatically increased compared to other folks, and them feeling not valued, and compared to other workers, and so we've really here I've taken a very proactive stance in that is how do I make sure that they feel safe. So we started really, objectively talking about, how are we making the environment safer. We started talking about that. But then we made it okay to go asking for help, right? We started training our managers on understanding, giving them skills to be able to recognize when their team members were struggling, and then giving them a pathway to get there. We started making sure that we have something in the hospital. It's kind of quirky. I have a sign that says, "How do I make this hospital a better place to work?" And I hold it, and there's a QR code, and people send in different things, and my team looks at it and we chronicle it, and some things we can't address, like I can't put up a new building. Sorry, I wish
Correct.
I could. But there's a lot of things I can quickly, and giving, and then making sure there was a lot of forums that were, both meetings as well as organic, that made people feel like they can approach my senior leadership team. We call it, I mentioned it in the past, I call it my senior leadership approachability plan. It's not, I don't really care about being visible. I am visible. I'm around. But that, just because you're visible doesn't mean anything. You have to be approachable and be able to listen and then do something with it. And so I've made it, in my time as a president for 4 years, I've been working on that so that people feel comfortable coming and telling me things. And sometimes they'll tell me things that it's surprising that they would come to the president to tell, but I love it because it just means they feel comfortable.
And that means you're doing your job, Doc.
Yeah.
That's what you wanted, right?
Yeah.
You
Yep.
wanted to, hey, come to me whenever.
Absolutely.
What's funny is when you said, I can't put up a new building. Why do people even send those in? Like, come on, you trying to stress me out here? Like, why do you do that?
But they're right. I do need a new building. I just can't afford one yet.
Exactly. What do you want me to do? All right, we ain't got the money. We're trying to all get paid here.
Yeah.
Now, this is cool, man. I think what's also interesting that you mentioned is that there are only 2 physician leaders across 8 hospitals in Rhode Island as well. Obviously, the ratio is a little low there. What does that gap matter to you, or just matter in general?
I think I think it's variable in each part of the country. I think physicians in there's a lot of physician leaders, but physicians in a president or CEO role are less. and you know, two in this state that I was talking to you about. But I think that's slowly changing. I mean, I think one of the things that I know I do is I encourage every physician to think about leadership. It doesn't have to be going into leadership like I did, but lead your own area. And the more I think more clinicians, I say physician leaders, but really clinical leaders, that nurses, therapists that are involved in management and leadership, I think the better, my personal feeling is the better care we're going to end up providing. And I think we're starting to see more and more clinicians get into this role, but it's also formalized training. I think it's important to learn like how to be a leader, understand the finances, you know, all of those things you kind of work towards. I'm biased, obviously. I think clinicians at the top level of a health system is great. There's obviously, I know a lot of non clinicians doing that role. They're doing a fantastic job. It's not, you know what I mean? It's just personally, I get a lot of value for being able to see both sides.
It's cool, man. It's pretty sure you never expected it. Here you are. You were probably always meant to be a leader. You just didn't know it. You went and picked up something and realized, hey, not only did I pick up a trade or you know, a career, but now I can help others in this career. That's really right. That's really what it was for you. And you want a more diverse leadership path, not just the MBAs, right?
Yeah.
You could kind of correct me on that if I'm wrong. But what would you tell those residents today that they're just kind of curious about leading, not just practicing? What is your message to them?
Yeah, my message to them is excellent. Ask a lot of questions, follow a lot of people, get a lot of mentors, figure out what really makes you makes you happy and makes you feel fulfilled. And you know what I do is I'm doing the business. I'm running a hospital, so I'm talking about who's taking, you know, what contracts we have for trash, right? Well, maybe that's not going to be for you, but there's a lot of quality improvement. There's running physician groups. There's so many aspects of leadership that some of it's very finance focused and other is more process improvement. And so think about those areas where what makes you feel fulfilled. I'm a numbers guy, so I never, you know, it's funny, I was always been a numbers guy, but I went to med school and I lost that piece for a while. And so I just absolutely love the fact that I get to, you know, work with finances, work with people, and provide better care. So I feel like I got all of it. You know,
you're winning. You're getting all your cups filled.
Yeah, that's what I feel.
You know what I mean? Let's go. No, I like that, and I like that you found your lane and things that truly make you happy in this space. And I can't wait to see really what continues to happen. Right? It looks like you're shooting for the stars right now, man. So wherever you land is a win, I think. Right? Yeah. Someone that was actually working on the front line. Right now, you're just winning, just being here. And how do you personally stay grounded? We talked about just mindset, right? Yeah. I can only imagine burnout happens as well at that. Yeah. Holding that kind of big, what you call it, just title, right?
Yeah.
Just, how do you stay focused, grounded when things get a little challenging, a little bit tough?
Yeah, I mean, I think a couple of things. I think how I was brought up, well, it's going to be hard for. I'm not going to ever get. I'm just not that person. That's not how I was raised. And the other is, my success in leadership has to be with my philosophy, which is really leader of equals, is how I've always practiced, as how I've always led, and so I've just kind of continued it because that's how I got success. And then the third is I have 5 kids. They keep you grounded. They don't let your head get too big. Don't worry.
That's funny. I love it. Listen, I got a 1-year-old and 4-year-old now, and my 4-year-old, man, the things that she says. So I can only imagine. She's saying this to me now. What the heck is she going to be saying to me a little older? You know, she's a little older.
Oh yeah.
I love it. I think it's funny. I definitely got to find a balance in myself because I can't just laugh at everything.
Yeah.
She's going to go to school and do this exact thing. But no, I love it. I love that you mentioned your kids, man. I can only imagine they truly make a difference. It allows us to realize that it's not even about us anymore. You know, it's about what we do for the future, and what you're doing for the future is letting them know that anything is possible. You know, there's that. What I love about the way I've looked at leadership and even looked at the path I took was I didn't graduate college, but I still, you know, I owned businesses and operated businesses, right? And I still got to the C-suite space, and now I'm actually doing my own thing, coaching, consulting, and it just goes to show. But I did go to school. You know, I probably got like 3 credits left to get an associate's degree. So I could go, but the only reason I even started school, knowing that I didn't need it, was because I wanted to show there was 2 different paths, and you have an option. Just don't sit there and think something's gonna happen for you. You have to work for it. As you mentioned, it's not in your blood to not put in the work.
Yeah.
Like, you just want to be better every day. You just want to be better, whatever that looks like.
Yeah.
If it's a better CEO today, then I'm gonna want to be a better CEO
That's right.
today. If today I want to go own my thing, I want to just do better. So now I appreciate you, man.
Yeah.
Where can people connect with you when they talk about? I can only imagine people are gonna be knocking on your door. Where can they connect with you? And is there anywhere else that you would like to direct us to, so we can get more information about just leadership in this space?
LinkedIn's a great place. Facebook's a great place. I can give you my email, and they're welcome to connect. I love.
Can you get your social security too, though, Doc? I mean,
Yeah, I draw the line at Social Security and my bank account and my PIN number. But outside of that, I'm pretty accessible. I mean, I think I got here not simply because I did all this work. I got here because I have a lot of mentors who've guided me along the way, right? And so I think paying forward things like that's really important. So when people ask, I'm like, yeah, come on, give me a call. Let's talk about it, because I think that's important.
Yeah, I think it's important, but I think for some apparent reason, there's a stigma that you don't speak to these high-end corporate leaders.
Yeah.
And it's so false, right?
Yeah.
And I love when someone like yourself says, no. Like, that's not the stigma here.
Yeah.
You come knock on my door, I'm willing to talk. And I've
Yeah.
seen so many great CEOs that do that.
Yeah.
And just great leaders, not even CEOs, but just great leaders that are involved that way. And some that are not, right? And they're all not going to be amazing. You
Yeah.
got to learn from them as well. Learn from those that you feel are not amazing. There's something also there to be learned. And then also learn from those that, as you mentioned, pour into you and really kind of lead you to become a better version of yourself. So I do definitely agree with what you're saying, man.
Excellent.
So it's time for that blind question. Are you ready?
Yeah.
If you had one word to say to that young aspiring leader that wants to take the leap of faith, but is just too scared, what are those words to them?
I would say jump in with both your feet. It's so rewarding, and recognize that you're going to fail along the way, but that's how you learn. And to jump in, it's so fulfilling when you can kind of get the sense of, like you said it exactly, multiplication, right? When you feel like you can impact more, it's just it's a rewarding feeling.
Hell yeah. And what's your blind question for the next?
So what I wanted to know is, do they think leaders are born or developed?
Ooh, that's really good. Oh, man. I feel like, can I answer this?
Yeah, go for it. You just can't tell the next person what your answer was.
Yeah, I won't. I think life experiences teach you leadership. I would say something that you probably have to learn. I can imagine me being born and just, I don't know. That's actually a really good question. You got to think deep into it. That's one of those that you really got to think deep into it. But for me, I felt how I became a leader was life experiences.
Yeah.
Right. The always having to overcome the sexual abuse, the adoption, wanting to break a cycle.
Yeah.
Like, that's how you become a leader, right? If you don't like something, then what are you doing to fix the problem?
Yeah.
So could have been born in us, maybe. Like, God could have already had this story written out for us.
Yeah.
So I could take it there. Like, this is just God's story, right?
Yeah.
We're just living it. So that's a really good one. I would love to know what the next leader actually says on that one. Okay, cool, man. Well, listen, it's been a pleasure. Thank you so much for having this conversation. I can only imagine that you're such a busy person, but you took time for us today. And I hope that other leaders learn from you. Those that are practicing right now, that they learn that it is okay to be called a suit. Maybe that's a thing as well. Maybe people just don't want to be called the suit. They feel like,
I like
I'm
this
a bad
suit.
guy.
You like it?
You look good in it. Yeah, you look good. Right? I would like to be called the suit as well. No, but man, congratulations on your success. May you continue to just make a difference in healthcare as well. It looks like you're already ahead of the game when you talk about AI. So many people in your seat. They're a little nervous. They're a little scared, man. But you realize, like, no, it's definitely a tool to help us. So we thank you. Guys, make sure you guys do like, comment, and subscribe. The only way we can talk to more leaders and share the insights that they're giving us, it's free. You just have to just share, like, subscribe, comment, tag somebody. It all is free, and we get to speak to other leaders just like this. So, Doc, we appreciate you, man.
Anytime.
My name's Efrain. We'll catch you guys on the Hard and Hustle next time. Laters.
Thanks. Bye, Efrain.